In Nagaland, 5 frontline workers have tested positive for COVID-19. Amongst them were 4 bus drivers and 1 staff of the Naga Hospital Authority Kohima. All the 5 positive cases are said to be asymptomatic. Principal Director of the Health and Family Welfare Department, Vizolie Z Suokhrie, informed that all the 5 positive cases are local transmission, as they are contracted the virus through the contact with high-risk returnees. Here's a report. In Nagaland, 5 frontline workers have been infected with COVID-19 while in the line of duty. 1 person is a healthcare worker from Kohima, 4 others are bus driver from Kohima and Dimapur. Addressing the media person at the Directorate of Health and Family Welfare at Kohima on 25 June, Principal Director Dr. Vizolie Z said that 5 frontline workers have been tested COVID-19 positive, which included 4 bus driver and 1 receptionist. He informed that the contact tracing has been done and the locality in which the healthcare worker resides have been declared as a containment zone.
We have 4 cases which is found to be positive among the frontline workers, that is 4 bus drivers and 1 receptionist, so 5 other transmission is yet to be ascertained, but contact tracing, I was told that they have completed. So contact tracing is completed means that test will be started among these people.
The Principal Director said that the department is contemplating to embark on social behavior of returnees, especially from Chennai. Currently, most of the positive cases are returnees from Chennai.
Quite many positive cases. And one thing which we have observed was maximum of the positive cases are from Chennai returnees. Maximum per district, if we look at it, Peran and more.
Health officials fear that there could be transmission to frontline workers and the people who have come in contact with their escapee, as they contracted the virus through contact with high-risk returnees. Dr. Suokhrie alleged that the increase in the cases of COVID-19 was also due to the unruly behavior of inmates in the quarantine center. But he lauded that the inmates of Mokokchung and Longlang, where discipline is strictly maintained.
Now decongestion is started, including the quarantine centers and also in the COVID hospitals. And in the COVID hospital, if any symptoms is there, and then in the isolation ward, if any suspected contact persons or first primary contact or close contacts, if we identify it, we put them in, immediately segregate them into the isolation ward and go for the testing.
Meanwhile, Dr. Suokhrie said recovery rate in the state is high and the reasons could be due to strong immunity system, as most of them are between the age group of 20 to 40 years of age. He said positive patients are being administered with vitamin C and zinc, as most of them are asymptomatic.
One more thing which we have done during this last 2-3 weeks is that we could activate many more COVID care centers. And these COVID care centers are the cases where it's found to be positive without symptoms. We are taking in the COVID care centers so that management will become easier.
Health officials said COVID-19 is a self-limiting virus and this can be prevented if people maintain proper hygiene and, most importantly, social distancing. While Dr. Suokhrie also said with the installation of TrueNet machines and BSL testing capacity will increase. We have to learn to live with coronavirus, he said, adding that his department will continue to put effort to create more awareness activities on prevention measures in rural areas.
If we look at our present situation today, I think our state is fortunate to have to activate testing facility in all the districts. That TrueNet is made available in all the districts, and apart from that, BSL-3 has been activated. Now, very soon we are going to have BSL-2 lab in Dimapur. That will be activated very soon.
Dr. Suokhrie also stated that the department is moving on a fast track to recruit the 390 posts of the health workers following the approval of the state cabinet so that the manpower is strengthened not only to fight COVID-19 but also to provide healthcare services to the general common diseases. In Kohima.